Question 1. The risk matrix shows a moderate likelihood of a critical, but unconfirmed, finding in a patient undergoing urgent investigation. The pathologist has identified preliminary evidence suggestive of this finding, but further confirmatory tests are required and will take 48 hours to complete. The clinical team is awaiting this information to guide immediate management decisions. What is the most appropriate role of the pathologist in this situation? Option A. Report the preliminary findings as a definitive diagnosis to the clinical team, as the evidence is strongly suggestive. Option B. Withhold all diagnostic information until the confirmatory tests are completed to avoid any potential misinterpretation of preliminary results. Option C. Inform the patient directly about the preliminary findings, advising them to await further confirmation. Option D. Communicate the preliminary findings to the clinical team, clearly stating the provisional nature of the diagnosis and the need for confirmatory testing, and offer to discuss the implications in a multidisciplinary setting. The correct answer is D. Communicate the preliminary findings to the clinical team, clearly stating the provisional nature of the diagnosis and the need for confirmatory testing, and offer to discuss the implications in a multidisciplinary setting. Explanation. Scenario analysis. This scenario presents a professionally challenging situation where a pathologist must balance the immediate need for diagnostic information with the potential for significant patient harm due to an unconfirmed diagnosis. The challenge lies in the inherent uncertainty of diagnostic processes and the critical impact of timely, yet accurate, results on patient management. The pathologist's role extends beyond mere technical analysis to encompass ethical responsibility and professional judgment in communicating findings. Correct approach analysis. The correct approach involves a structured, evidence-based communication strategy that prioritizes patient safety and informed decision-making. This aligns with the FRCPath's emphasis on professional conduct, patient-centered care, and the responsible interpretation and dissemination of diagnostic information. By clearly articulating the preliminary nature of the findings, outlining the necessary confirmatory steps, and engaging in a multidisciplinary discussion, the pathologist upholds the highest standards of practice. This approach ensures that clinicians receiving the information understand its limitations and can make appropriate clinical decisions, thereby preventing potential iatrogenic harm. It reflects the pathologist's role as a key member of the healthcare team, providing expert interpretation and guidance. Incorrect approaches analysis. One incorrect approach would be to withhold all information until absolute certainty is achieved. This fails to acknowledge the urgency often associated with diagnostic work and can lead to significant delays in patient management, potentially causing harm through inaction. It also neglects the pathologist's responsibility to provide timely, albeit preliminary, insights to guide clinical teams. Another incorrect approach would be to communicate the preliminary findings as definitive without any caveats. This is a direct breach of professional integrity and ethical responsibility. It misrepresents the diagnostic process, potentially leading clinicians to make critical treatment decisions based on incomplete or inaccurate information, thereby endangering the patient. This disregards the fundamental principle of accurate reporting and the potential for diagnostic error. A third incorrect approach would be to communicate the preliminary findings directly to the patient without involving the treating clinician. This bypasses the established communication channels within the healthcare team, undermining the clinician's role in patient management and potentially causing undue distress to the patient by presenting unconfirmed information without appropriate clinical context and support. It also fails to adhere to the established protocols for communicating sensitive diagnostic information. Professional reasoning. Professionals should adopt a systematic approach to diagnostic communication. This involves 1. Understanding the clinical context and urgency of the request. 2. Performing a thorough diagnostic analysis, acknowledging any limitations or uncertainties. 3. Communicating findings clearly and concisely to the appropriate clinical team, explicitly stating the level of certainty and any necessary confirmatory steps. 4. Participating in multidisciplinary discussions to ensure integrated patient care. 5. Adhering to institutional policies and professional guidelines regarding the reporting of diagnostic results. Question 2. Cost-benefit analysis shows that implementing a rigorous, multi-observer consensus approach for grading and staging complex oncological specimens, even if it slightly increases turnaround time, offers superior patient outcomes and resource utilization compared to a single pathologist rapid assessment. Considering the fellowship of the Royal College of Pathologists, FRCPath, examination's emphasis on diagnostic accuracy and adherence to UK regulatory frameworks for pathology reporting, which of the following approaches best reflects optimal professional practice in this context? Option A. Employing a subjective assessment of tumor features based on general experience, without strict adherence to specific grading or staging criteria, to allow for flexibility in interpretation. Option B. Adhering strictly to established, evidence-based grading and staging systems, consulting relevant guidelines, and seeking peer review for complex or discordant cases to ensure diagnostic accuracy and consistency. Option C. Prioritizing rapid reporting by relying primarily on the experience of the reporting pathologist with minimal formal consultation to expedite treatment initiation. Option D. Focusing solely on the most obvious prognostic indicators and omitting detailed assessment of less apparent features to reduce reporting time. The correct answer is B. Adhering strictly to established, evidence-based grading and staging systems, consulting relevant guidelines, and seeking peer review for complex or discordant cases to ensure diagnostic accuracy and consistency. Explanation: this scenario presents a professional challenge due to the inherent variability in interpreting histological features for tumor grading and the potential for significant clinical implications arising from staging discrepancies. Pathologists must exercise meticulous judgment, balancing diagnostic accuracy with the need for timely and appropriate patient management. The FRCPath curriculum emphasizes a standardized approach to grading and staging to ensure consistency and comparability of patient outcomes, aligning with UK National Health Service (NHS) guidelines and Royal College of Pathologists recommendations. The correct approach represents best professional practice because it adheres strictly to established, evidence-based grading and staging systems, e.g., TNM for staging, and specific histological grading systems like Gleason for prostate cancer or Nottingham for breast cancer. This adherence ensures that diagnoses are reproducible, facilitating effective communication between multidisciplinary teams, informing treatment decisions, and enabling accurate epidemiological studies and audit. It upholds the ethical duty of care to the patient by providing the most accurate prognostic information possible, thereby guiding appropriate therapeutic interventions and resource allocation within the NHS. An incorrect approach that relies solely on subjective assessment without reference to established criteria fails to meet professional standards. This can lead to inter-observer variability, misclassification of tumor aggressiveness, and consequently, inappropriate treatment plans. Such a failure constitutes a breach of professional responsibility and potentially violates guidelines set by regulatory bodies like the General Medical Council, GMC, regarding competence and professional conduct. Another incorrect approach, such as prioritizing speed over thoroughness in grading and staging, risks overlooking critical diagnostic features, leading to under- or overstaging. This not only compromises patient care, but also undermines the integrity of the pathology service and can lead to resource misallocation within the NHS. Professionals should employ a decision-making framework that involves 1. Thoroughly reviewing all available clinical information. 2. Applying the most current and validated grading and staging systems relevant to the specific tumor type, referencing established guidelines and textbooks. 3. Consulting with colleagues or seeking a second opinion when faced with ambiguous or challenging cases. 4. Documenting the grading and staging process meticulously, including the criteria used and any deviations from standard practice with justification. 5. Engaging in continuous professional development to stay abreast of evolving diagnostic criteria and technologies. Question 3. The evaluation methodology shows that a pathologist, reviewing a complex diagnostic sample, identifies findings that, while not directly impacting the patient's immediate treatment, strongly suggest a pattern consistent with a serious infectious disease with significant public health implications, and also raise concerns about potential criminal activity. The pathologist is aware of the patient's history of noncompliance with public health directives. The pathologist must decide how to proceed regarding the disclosure of these findings. Option A. Immediately report the findings to the police and public health authorities without further consultation, citing the potential public health risk and criminal implications. Option B. Seek immediate advice from the Royal College of Pathologists and the institution's legal department to determine the appropriate course of action, balancing patient confidentiality with public health and legal obligations. Option C. Discuss the case and findings with other pathologists and clinicians not directly involved in the patient's care to gather opinions on the implications. Option D. Maintain strict patient confidentiality and take no further action, as the findings do not directly affect the patient's current medical management. The correct answer is B. Seek immediate advice from the Royal College of Pathologists and the institution's legal department to determine the appropriate course of action, balancing patient confidentiality with public health and legal obligations. Explanation. This scenario presents a professional challenge due to the inherent conflict between a pathologist's duty to patient confidentiality and the potential need to disclose information that could impact public health or legal proceedings. The pathologist must navigate the complex ethical landscape of balancing individual privacy rights against broader societal interests, all within the strictures of the UK's regulatory framework for medical professionals, including guidelines from the Royal College of Pathologists and relevant legislation, such as the Data Protection Act 2018 and the Human Rights Act 1998. Careful judgment is required to ensure any disclosure is lawful, proportionate, and ethically justifiable. The correct approach, which involves seeking guidance from the appropriate professional bodies and legal counsel before making any disclosure, represents best professional practice. This aligns with the General Medical Council's (GMC) guidance on confidentiality, which emphasizes that disclosure of patient information is permissible only in specific, legally defined circumstances, such as where required by law or where it is in the public interest and proportionate. Consulting with the Royal College of Pathologists and seeking legal advice ensures that the pathologist acts in accordance with professional standards and legal obligations, minimizing the risk of breaching confidentiality unlawfully or unethically. This proactive step demonstrates a commitment to responsible practice and patient welfare. An incorrect approach that involves immediate disclosure to the police without exploring other avenues or seeking appropriate advice fails to uphold the principle of patient confidentiality. This could constitute a breach of the Data Protection Act 2018 and the GMC's guidance, potentially leading to disciplinary action. Another incorrect approach, which is to ignore the potential implications and take no action, abdicates professional responsibility. While patient confidentiality is paramount, a pathologist has a duty to consider the wider implications of their findings, particularly when they may relate to serious harm or public safety, and to act appropriately within legal and ethical boundaries. Failing to act could have serious consequences for public health or the administration of justice. A third incorrect approach, which is to discuss the matter with colleagues not directly involved in the patient's care or the investigation, breaches confidentiality and professional boundaries, creating unnecessary risk and potential for misinformation. The professional reasoning process for such situation should involve a structured approach. First, identify the ethical and legal obligations related to patient confidentiality and potential disclosure. Second, assess the specific circumstances and the nature of the information in question. Third, consult relevant professional guidelines, e.g., from the Royal College of Pathologists and GMC, and seek advice from senior colleagues, institutional legal advisors, or relevant professional bodies. Fourth, weigh the competing interests, considering the potential harm of disclosure against the potential harm of non-disclosure, ensuring any action taken is proportionate and lawful. Finally, document all decisions and actions taken. Question 4. The control framework reveals a scenario where a pathologist is examining a renal biopsy for suspected membranous nephropathy. Initial light microscopy shows thickened glomerular basement membranes and some podocyte effacement, but the precise nature of the subepithelial deposits remains unclear. The pathologist needs to definitively characterize these deposits to guide treatment. Considering the FRCPath examination's emphasis on diagnostic accuracy and appropriate technique selection, which of the following approaches best reflects best professional practice in this situation? Option A. Utilize transmission electron microscopy to visualize the ultrastructure of the glomerular basement membrane and subepithelial space, allowing for detailed characterization of the electron-dense deposits. Option B. Proceed directly to immunofluorescence microscopy to assess for immunoglobulin and complement deposition, as this is the gold standard for diagnosing immune-mediated glomerular diseases. Option C. Conclude the diagnosis based on the light microscopy findings alone, as the observed changes are highly suggestive of membranous nephropathy, and further investigation would be redundant. Option D. Perform serial dilutions of the patient's serum and urine for immunodiffusion, assays to quantify specific antibody levels against potential causative antigens. Correct answer is B. Proceed directly to immunofluorescence microscopy to assess for immunoglobulin and complement deposition, as this is the gold standard for diagnosing immune-mediated glomerular diseases. Explanation. This scenario presents a professional challenge in diagnostic pathology, where the choice of microscopy technique directly impacts diagnostic accuracy and patient care, necessitating careful judgment. The challenge lies in selecting the most appropriate tool for visualizing specific cellular and subcellular structures to confirm or refute a suspected diagnosis, balancing the need for detailed information with practical considerations. The correct approach represents best professional practice because it aligns with the fundamental principles of diagnostic pathology and the implicit requirements of the FRCPath curriculum, which emphasizes the application of appropriate investigative techniques, utilizing light microscopy for initial assessment, and then employing electron microscopy for definitive ultrastructural detail when indicated by light microscopy findings, is a standard, evidence-based diagnostic pathway. This approach ensures that the most informative and cost-effective methods are used sequentially, adhering to the principle of obtaining the highest quality diagnostic data for patient management. It reflects a thorough understanding of the capabilities and limitations of each technique, as expected of a fellow of the Royal College of Pathologists. An incorrect approach involving the immediate reliance on electron microscopy without prior light microscopy assessment would be professionally unacceptable. This failure stems from a disregard for established diagnostic workflows and an inefficient use of resources. Electron microscopy is a highly specialized and time-consuming technique, typically reserved for situations where light microscopy is insufficient to provide a definitive diagnosis. Its indiscriminate use would represent a significant deviation from best practice, potentially delaying diagnosis and incurring unnecessary costs, which could be seen as a breach of professional responsibility and potentially a failure to adhere to departmental or institutional guidelines for diagnostic testing. Another incorrect approach, relying solely on light microscopy when ultrastructural detail is clearly required for diagnosis, would also be professionally unacceptable. This represents a failure to recognize the limitations of the chosen technique and a potential compromise of diagnostic accuracy. In cases where specific subcellular abnormalities are suspected and are beyond the resolution of light microscopy, failing to escalate to electron microscopy would be a critical diagnostic error, potentially leading to misdiagnosis and inappropriate patient management. This would fall short of the expected standard of care and the diagnostic rigor required for FRCPath qualification. The professional decision-making process for similar situations should involve a systematic evaluation of the clinical context, the initial light microscopic findings, and the specific diagnostic questions that need to be answered. This includes understanding the resolution limits and the types of structures best visualized by each microscopy technique. A tiered approach, starting with the most accessible and informative technique, light microscopy, and progressing to more specialized techniques, electron microscopy, confocal microscopy, only when necessary, is the most prudent and professionally sound strategy. This ensures that diagnostic investigations are targeted, efficient, and ultimately serve the best interests of the patient. Question 5. Benchmark analysis indicates that a trainee pathologist under supervision has provided a preliminary interpretation of a cervical cytology sample that is discordant with the expected findings based on the patient's clinical history and the gross appearance of the sample. The trainee's interpretation suggests a benign process, while the clinical context and gross features raise suspicion for a significant neoplastic change. The supervising consultant pathologist must decide how to proceed. Which of the following represents the most ethically sound and professionally responsible course of action? Option A. Engage in a detailed discussion with the trainee to understand their rationale, followed by a joint, meticulous re-examination of the cytological slide, focusing on areas of discrepancy and consulting relevant diagnostic guidelines. Option B. Immediately override the trainee's interpretation and dictate the diagnosis based on the clinical history and gross appearance, as this is the most efficient way to ensure patient safety. Option C. Accept the trainee's interpretation without further review, assuming the trainee has correctly identified subtle features that the senior pathologist may have overlooked due to the gross appearance. Option D. Prioritize the gross appearance and clinical history, dismissing the trainee's interpretation as likely due to inexperience and proceeding with a diagnosis based solely on these external factors. Correct answer is A. Engage in a detailed discussion with the trainee to understand their rationale, followed by a joint, meticulous re-examination of the cytological slide, focusing on areas of discrepancy and consulting relevant diagnostic guidelines. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in cytopathology, where a trainee's preliminary interpretation differs significantly from the expected findings based on clinical history and gross appearance. The challenge lies in balancing the need for accurate diagnosis, patient care, and the professional development of the trainee. Overriding a trainee's interpretation without thorough investigation can undermine their confidence and learning, while accepting an incorrect interpretation can lead to misdiagnosis and patient harm. The pathologist must navigate this delicate balance, ensuring both diagnostic integrity and educational responsibility. Correct approach analysis. The correct approach involves a systematic and collaborative review process. The senior pathologist should first engage in a detailed discussion with the trainee, understanding their rationale and identifying specific features that led to their interpretation. This dialogue is crucial for assessing the trainee's understanding and identifying potential learning gaps. Following this, a meticulous re-examination of the slide, ideally by both the trainee and the senior pathologist, is essential. This re-examination should focus on areas of discrepancy, comparing findings against established diagnostic criteria and relevant literature. The senior pathologist's role is to guide this process, ensuring all diagnostic possibilities are considered, and that the final interpretation is evidence-based and aligns with best practice guidelines for cytological sample interpretation, as mandated by the Royal College of Pathologists standards for postgraduate training and practice. This approach upholds the principle of beneficence by ensuring diagnostic accuracy and non-maleficence by avoiding potential harm from misdiagnosis, while also supporting the trainee's professional growth. Incorrect approaches analysis. Accepting the trainee's interpretation without independent verification, despite strong clinical suspicion of a different diagnosis, represents a failure in due diligence and professional responsibility. This could lead to a delayed or incorrect diagnosis, potentially causing significant harm to the patient, violating the principle of non-maleficence. It also fails to adequately supervise and guide the trainee, hindering their development. Immediately overriding the trainee's interpretation and dictating the correct diagnosis without a thorough discussion or re-examination is dismissive and detrimental to the trainee's learning experience. It undermines their confidence and discourages critical thinking, failing the educational mandate of postgraduate training. While the senior pathologist's expertise is paramount, the process of reaching a diagnosis should be a learning opportunity. Focusing solely on the gross appearance and clinical history to dismiss the trainee's interpretation without a careful review of the cytological material is a significant error. Cytological interpretation requires meticulous microscopic examination, and the trainee's observations, even if initially incorrect, may highlight subtle features that warrant further investigation. This approach prioritizes external factors over direct microscopic evidence, compromising diagnostic accuracy. Professional reasoning. Professionals faced with such a situation should employ a structured decision-making process. Firstly, acknowledge the discrepancy and the potential implications for patient care and trainee development. Secondly, initiate a collaborative review, fostering open communication with the trainee to understand their reasoning. Thirdly, conduct a thorough, independent re-examination of the specimen, critically evaluating all morphological features in light of the clinical context and established diagnostic criteria. Fourthly, consult relevant literature or colleagues if diagnostic uncertainty persists. Finally, document the entire process, including the initial interpretation, the review process, and the final diagnosis, ensuring transparency and accountability. This systematic approach ensures diagnostic accuracy, patient safety, and effective professional development. Question 6. Compliance review shows a junior pathologist has submitted a preliminary interpretation of a complex endometrial biopsy, highlighting only the presence of stromal decidualization while omitting detailed assessment of glandular atypia and mitotic activity. The clinical history indicates postmenopausal bleeding. What is the most appropriate next step in the interpretation process? Option A. Focus further investigation on identifying specific types of stromal cells, as this may provide a definitive diagnosis. Option B. Request additional clinical information regarding the patient's hormone replacement therapy status before proceeding with further histological assessment. Option C. Immediately issue a report stating the presence of decidualized stroma, as this is a significant finding in postmenopausal bleeding. Option D. Conduct a thorough review of the entire histological section, systematically assessing glandular morphology, nuclear features, mitotic counts, and stromal changes, and correlate these findings with the clinical history and any available immunohistochemical results. The correct answer is D. Conduct a thorough review of the entire histological section, systematically assessing glandular morphology, nuclear features, mitotic counts, and stromal changes, and correlate these findings with the clinical history and any available immunohistochemical results. Explanation. Scenario analysis. This scenario presents a common challenge in histopathology, the interpretation of a complex histological section with potentially ambiguous features. The professional challenge lies in accurately diagnosing the underlying condition, which has direct implications for patient management, treatment decisions, and prognosis. The pathologist must integrate morphological findings with clinical information and potentially ancillary tests, all while adhering to established diagnostic criteria and quality standards. The pressure to provide a timely and accurate diagnosis, coupled with the inherent subjectivity in interpreting subtle histological nuances, necessitates a rigorous and systematic approach. Correct approach analysis. The correct approach involves a systematic evaluation of the histological section, focusing on key morphological features such as cellular morphology, architectural patterns, inflammatory infiltrates, and evidence of malignancy or reactive changes. This is underpinned by the FRCPath curriculum, which emphasizes a thorough understanding of disease processes at a cellular and tissue level, and the ability to apply diagnostic criteria consistently. Best professional practice dictates correlating these findings with the provided clinical history and any available ancillary investigations, e.g., immunohistochemistry, molecular pathology. This comprehensive approach ensures that the diagnosis is not solely based on morphology, but is contextualized, leading to a more accurate and clinically relevant report. Adherence to Royal College of Pathologists guidelines and local laboratory protocols for specimen handling, reporting, and quality assurance is paramount. Incorrect approaches analysis, focusing solely on a single, prominent feature without considering the broader histological context, is a significant regulatory and ethical failure. This can lead to misdiagnosis due to overlooking other crucial diagnostic clues or artifacts, violates the principle of thoroughness expected in diagnostic pathology, and contravenes FRCPath standards for comprehensive assessment. Relying exclusively on pattern recognition without understanding the underlying pathobiology or diagnostic criteria is another failure. This approach is prone to errors, especially in cases with unusual presentations or rare conditions, and does not demonstrate the depth of knowledge required for FRCPath. It risks misinterpreting benign mimics as malignant or vice versa, leading to inappropriate patient management. Ignoring the clinical history and ancillary investigations is a critical ethical and professional lapse. Pathology reports are intended to be integrated with clinical information. Failing to do so can result in a diagnosis that is morphologically correct but clinically irrelevant or misleading, potentially causing patient harm. This breaches the duty of care and the collaborative nature of patient management. Professional reasoning. Professionals should approach complex histological interpretations by first reviewing the provided clinical information to understand the context of the specimen. Subsequently, a systematic microscopic examination should be performed, systematically assessing cellular details, tissue architecture, and any abnormal features. This should be followed by a critical evaluation of the findings against established diagnostic criteria and differential diagnoses. If uncertainty exists, consultation with senior colleagues or referral for expert opinion is a crucial step. Furthermore, the judicious use of ancillary techniques, guided by the initial morphological assessment in clinical context, is essential. Finally, the report should clearly articulate the findings, the diagnostic reasoning, and any limitations or recommendations for further investigation, ensuring clarity and facilitating appropriate clinical decision-making. Question 7. Assessment of the most appropriate action when a critical care unit requests urgent results for a patient, but the laboratory's internal quality control, QC, for the relevant assay has just flagged an out-of-specification result, and the scheduled QC review meeting is not for another 24 hours. Option A. Immediately initiate a full investigation into the out-of-specification QC result, including repeating the QC, checking instrument logs, and consulting the manufacturer's troubleshooting guide, while informing the requesting clinician of the potential delay due to QC issues. Option B. Proceed with releasing the patient's results after a brief visual inspection of the QC data, assuming the deviation is minor and unlikely to affect the patient's outcome, and document the deviation for later review. Option C. Implement a modified, expedited QC protocol for this specific patient sample, focusing only on the most critical parameters to ensure a rapid turnaround time. Option D. Release the patient's results immediately as requested by the critical care unit, given the urgency, and perform the QC investigation retrospectively after all urgent samples have been processed. Correct answer is B. Proceed with releasing the patient's results after a brief visual inspection of the QC data, assuming the deviation is minor and unlikely to affect the patient's outcome, and document the deviation for later review. Explanation. Scenario analysis. This scenario presents a common challenge in laboratory management, balancing the need for rapid diagnostic turnaround with the imperative of maintaining robust quality control. The pressure to expedite results, particularly in critical care settings, can create a conflict with the time-consuming but essential processes of quality assurance. A pathologist must exercise sound judgment to ensure patient safety and diagnostic accuracy are not compromised by operational demands. Correct approach analysis. The correct approach prioritizes patient safety and diagnostic integrity by ensuring that all quality control procedures are completed and validated before releasing patient results. This aligns directly with the fundamental principles of good laboratory practice, as mandated by regulatory bodies overseeing medical laboratories in the UK, which emphasize the need for reliable and accurate testing. The Royal College of Pathologists guidance, while not a direct regulatory body in the same vein as UCAS or MHRA, strongly advocates for a culture of quality and safety, which underpins all aspects of laboratory operation. Adhering to established QC protocols, even under pressure, is a non-negotiable ethical and professional responsibility to prevent misdiagnosis and ensure appropriate patient management. This approach reflects a commitment to the highest standards of patient care and professional accountability. Incorrect approaches analysis. Releasing patient results without complete QC validation represents a significant regulatory and ethical failure. It directly contravenes the principles of good laboratory practice, which require that all analytical systems are functioning within acceptable performance limits before patient samples are processed. This could lead to inaccurate results, potentially causing patient harm, and would expose the laboratory and the reporting pathologist to serious professional and legal repercussions. Such an action demonstrates a disregard for established quality assurance frameworks and a failure to uphold the duty of care owed to patients. Failing to investigate an out-of-specification QC result before releasing patient data is another critical failure. QC is designed to detect analytical drift or instrument malfunction. Ignoring such deviations means that any subsequent patient results generated during the period of the out-of-specification QC are unreliable. This is a breach of professional duty and regulatory requirements, as it allows potentially erroneous data to influence clinical decisions. Implementing a rush QC protocol that bypasses critical steps, even with the intention of speeding up turnaround, is also unacceptable. QC procedures are validated and designed with specific steps to ensure their efficacy. Circumventing these steps undermines the entire purpose of QC and introduces an unacceptable level of risk. This approach demonstrates a lack of understanding of the scientific basis of QC and a prioritization of speed over accuracy, which is a serious professional failing. Professional reasoning. Professionals should employ a structured decision-making framework when faced with such dilemmas. This involves 1. Identifying the core conflict, balancing speed of reporting with quality assurance. 2. Recalling relevant professional standards and regulatory requirements, understanding the non-negotiable aspects of QC. 3. Assessing the potential impact of each course of action, considering patient safety, diagnostic accuracy, and professional accountability. 4. Consulting established protocols and seeking advice if necessary, not making unilateral decisions that deviate from best practice. 5. Prioritizing patient welfare and diagnostic integrity above all else, recognizing that speed is secondary to accuracy and safety. In this specific scenario, the decision-making process must lead to the conclusion that QC must be completed and validated before patient results are released, even if it means a delay in reporting. Question 8. Comparative studies suggest that turnaround times for toxicology drug monitoring assays can be influenced by laboratory workload and the complexity of analytical validation. In the context of UK National Health Service, NHS, practice, a clinical toxicologist receives a request for urgent drug monitoring. The laboratory is experiencing higher than usual sample volumes, and a specific assay requires a more intricate validation process due to recent reagent lot changes. The toxicologist is aware that adhering strictly to all quality control checks might extend the reporting time beyond the clinically ideal window. Which of the following represents the most appropriate professional approach? Option A. Report the results immediately without informing the clinician of any potential delays, assuming the quality control checks will be completed retrospectively. Option B. Communicate the estimated extended turnaround time to the requesting clinician, explaining the reasons for the potential delay, while ensuring all quality control procedures are meticulously followed before reporting results. Option C. Inform the clinician that the results will be significantly delayed without providing a clear estimate, leading to uncertainty in clinical decision-making. Option D. Expedite the reporting of results by bypassing certain quality control checks to meet the clinically ideal turnaround time, given the urgency of the request. The correct answer is B. Communicate the estimated extended turnaround time to the requesting clinician, explaining the reasons for the potential delay, while ensuring all quality control procedures are meticulously followed before reporting results. Explanation. Scenario analysis. This scenario presents a professional challenge for a clinical toxicologist working within the UK's National Health Service, NHS. The challenge lies in balancing the immediate clinical need for accurate drug monitoring, results with the potential for delayed reporting due to laboratory workload, and the need for rigorous quality assurance. The toxicologist must consider the impact of reporting delays on patient care, the ethical implications of providing potentially outdated information, and the regulatory requirements for laboratory practice in the UK, as governed by bodies like the UK Accreditation Service, UKAS, and the Royal College of Pathologists' own guidelines for good laboratory practice. The inherent variability in sample processing times and the potential for unexpected analytical issues add further complexity, demanding careful judgment. Correct approach analysis. The correct approach involves communicating the expected turnaround time, TAT, to the requesting clinician, acknowledging any potential delays, and ensuring that the laboratory's internal quality control procedures are robustly followed before releasing results. This aligns with best professional practice by upholding the principles of patient safety and accurate reporting. The Royal College of Pathologists guidelines emphasize the importance of timely and reliable diagnostic information. By proactively managing expectations regarding TAT and prioritizing quality assurance, the toxicologist ensures that the reported results are both clinically useful and analytically sound, thereby minimizing the risk of misinterpretation or inappropriate clinical decisions based on premature or inaccurate data. This also reflects the ethical duty of care to the patient and the professional responsibility to maintain high standards of laboratory performance. Incorrect approaches analysis. Reporting results prematurely without completing all necessary quality control checks is a significant regulatory and ethical failure. This breaches the fundamental principle of analytical validity, potentially leading to incorrect diagnoses or treatment adjustments, which could harm the patient. It also undermines the integrity of the laboratory service and violates the standards expected by regulatory bodies overseeing healthcare diagnostics in the UK. Failing to communicate potential delays to the requesting clinician while still adhering to quality control is also professionally suboptimal. While the results may eventually be accurate, the lack of proactive communication can lead to frustration for the clinician, potentially impacting patient management if they are making critical decisions based on an assumed TAT. This falls short of the professional expectation for clear and transparent communication within the multidisciplinary healthcare team. Overriding established quality control protocols to expedite reporting, even with the intention of improving TAT, is a severe breach of professional conduct and regulatory compliance. This compromises the reliability of the laboratory's output and could have serious consequences for patient safety. It directly contravenes the standards set by professional bodies and accreditation services, risking disciplinary action and damage to professional reputation. Professional reasoning. Professionals in this situation should employ a systematic decision-making process that prioritizes patient safety and analytical integrity. This involves 1. Understanding and adhering to the laboratory's established standard operating procedures, SOP, for sample processing and result reporting, including defined TATs. 2. Proactively assessing the current laboratory workload and identifying any factors that might impact TAT. 3. Communicating any anticipated delays or deviations from expected TAT to the requesting clinician in a clear and timely manner, explaining the reasons for the delay, e.g. workload, complex analysis, quality assurance checks. 4. Ensuring that all internal quality control measures are completed and satisfactory before releasing any results. 5. Documenting all communications and decisions made regarding sample processing and result reporting. 6. Escalating any significant issues or potential patient safety concerns to senior laboratory management or the clinical team as appropriate. Question 9. Strategic planning requires a pathologist to interpret complex electrolyte and acid-base profiles in a critically ill patient. The pathologist receives results showing a moderate hyponatremia, a mild hyperkalemia, and a significant metabolic acidosis with a high anion gap. Considering the patient's history of recent gastrointestinal losses and the initiation of a new medication, which of the following diagnostic interpretations best reflects a comprehensive and clinically relevant approach? Option A. Report the electrolyte and acid-base abnormalities as independent findings without attempting to link them to the patient's clinical context, advising the clinician to manage each abnormality separately. Option B. Focus solely on the high anion gap metabolic acidosis, attributing it to a common cause like lactic acidosis, and defer interpretation of the electrolyte abnormalities pending further clinical updates. Option C. Conclude that the hyponatremia and hyperkalemia are primary electrolyte imbalances requiring immediate correction, and the metabolic acidosis is likely due to a separate, undiagnosed condition. Option D. Integrate all findings, considering the potential contribution of gastrointestinal losses to the electrolyte derangements and the new medication to the metabolic acidosis, recommending further specific investigations to confirm the etiology. Correct answer is C. Conclude that the hyponatremia and hyperkalemia are primary electrolyte imbalances requiring immediate correction, and the metabolic acidosis is likely due to a separate, undiagnosed condition. Explanation. This scenario presents a professional challenge due to the critical nature of electrolyte and acid-base balance in patient care, directly impacting physiological function and requiring accurate diagnostic interpretation. The FRCPath examination expects candidates to demonstrate not just knowledge of these principles, but also the ability to apply them in a clinical context, understanding the implications of diagnostic findings for patient management. Careful judgment is required to differentiate between transient physiological fluctuations and clinically significant abnormalities that necessitate intervention. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based diagnostic process. This involves correlating laboratory findings with the patient's clinical presentation, history, and other relevant investigations. Such an approach aligns with the General Medical Council, GMC, Good Medical Practice Guidelines, which emphasize the importance of maintaining competence, acting in the best interests of patients, and ensuring safe and effective care. Specifically, it upholds the principle of providing a clear and accurate interpretation of diagnostic results to guide appropriate clinical decision-making, thereby preventing misdiagnosis and ensuring timely and effective treatment. An incorrect approach that relies solely on isolated laboratory values without clinical correlation represents a significant regulatory and ethical failure. This could lead to over-investigation or inappropriate treatment, potentially harming the patient and violating the GMC's duty of care. For instance, attributing a mild, transient electrolyte derangement to a chronic condition without considering recent fluid intake or medication changes would be a failure to exercise professional judgment. Similarly, ignoring a significant acid-base disturbance because it doesn't fit a preconceived diagnosis would be a failure to investigate thoroughly and act in the patient's best interest. Another incorrect approach might involve delaying reporting or interpretation of critical results, which could breach the Royal College of Pathologists standards for timely reporting and the GMC's requirement to act without delay when a patient is at risk. The professional decision-making process for similar situations should involve a structured approach. First, critically review the laboratory results in the context of the patient's overall clinical picture. Second, consider potential causes for any abnormalities, differentiating between physiological variations and pathological processes. Third, consult relevant guidelines or senior colleagues if uncertainty exists. Fourth, communicate findings clearly and concisely to the requesting clinician, highlighting any critical results and their potential implications. Finally, ensure appropriate follow-up is planned or recommended. Question 10. To address the challenge of ensuring optimal diagnostic accuracy from tissue samples, a pathologist is reviewing the standard operating procedures for tissue processing, considering the potential for processing artifacts to significantly impact diagnostic interpretation. Which of the following represents the most robust approach to risk assessment and mitigation within the laboratory setting? Option A. Implementing a comprehensive risk assessment framework that systematically identifies potential processing variables, evaluates their impact on diagnostic quality, and establishes specific control measures for each identified risk. Option B. Relying on the established routine processing protocols, assuming that standard procedures are inherently sufficient to prevent all significant artifacts. Option C. Prioritizing rapid turnaround times for tissue processing by streamlining steps and reducing validation checks to expedite sample analysis. Option D. Delegating all quality control checks related to tissue processing to the most junior laboratory technician without direct oversight. The correct answer is A. Implementing a comprehensive risk assessment framework that systematically identifies potential processing variables, evaluates their impact on diagnostic quality, and establishes specific control measures for each identified risk. Explanation. Scenario analysis. This scenario is professionally challenging due to the inherent risks associated with tissue processing, particularly the potential for artifacts that can lead to misdiagnosis. The integrity of diagnostic information hinges on the meticulous execution of each step. A failure in tissue processing can have severe consequences for patient care, impacting treatment decisions and prognosis. The pathologist must therefore exercise rigorous judgment, ensuring adherence to established protocols and a thorough understanding of potential pitfalls. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic accuracy through a systematic risk assessment. This involves identifying potential processing issues, evaluating their impact on diagnostic interpretation, and implementing mitigation strategies. This aligns with the overarching ethical duty of care incumbent upon a Fellow of the Royal College of Pathologists, which mandates the provision of high-quality diagnostic services. Furthermore, it reflects the principles of good laboratory practice, emphasizing quality control and continuous improvement to minimize errors and ensure reliable results, as expected within the UK regulatory framework for medical laboratories. Incorrect approaches analysis. An approach that relies solely on routine, without specific consideration for the nuances of the specimen or potential processing variables, is professionally unacceptable. This overlooks the possibility of unforeseen issues and fails to proactively address them, potentially leading to artifacts. Such a passive approach risks diagnostic errors and breaches the duty of care. An approach that prioritizes speed over thoroughness, perhaps by skipping validation steps or rushing through critical stages, is also professionally unacceptable. This directly compromises the quality of the process tissue and the reliability of subsequent diagnostic interpretation. It demonstrates a disregard for established protocols designed to ensure accuracy and could lead to significant patient harm, violating ethical and professional standards. An approach that delegates critical quality control checks to junior staff without adequate supervision or independent verification is professionally unsound. While delegation is a necessary management tool, the ultimate responsibility for diagnostic quality rests with the pathologist. Failure to ensure independent verification of critical steps introduces a significant risk of undetected errors, which is contrary to the principles of accountability and professional responsibility. Professional reasoning. Professionals should adopt a proactive and systematic approach to risk management in tissue processing. This involves 1. Specimen assessment, understanding the nature of the specimen and any specific requirements for fixation or processing. 2. Protocol review, ensuring that established protocols are appropriate and have been validated. 3. Hazard identification, identifying potential processing artifacts and their impact on diagnostic interpretation. 4. Mitigation strategies, implementing measures to prevent or minimize identified risks. 5. Quality control, establishing robust quality control procedures at critical junctures. 6. Continuous improvement, regularly reviewing processes and outcomes to identify areas for enhancement. This structured approach ensures that potential issues are addressed before they compromise diagnostic integrity, upholding the highest standards of patient care and professional practice. Question 11. Process analysis reveals a pathologist has encountered a novel, potentially more sensitive diagnostic assay for a specific condition. While preliminary research suggests promising results, the assay has not yet undergone formal validation studies within the UK, nor has it been approved for use in routine NHS diagnostic pathways. A pathologist is considering its immediate implementation in patient care to offer what they believe is a superior diagnostic option. Which of the following represents the most appropriate professional approach? Option A. Immediately implement the novel assay in patient care, prioritizing its perceived superior sensitivity over the lack of formal validation and regulatory approval, to provide patients with the most advanced diagnostic option available. Option B. Introduce the assay based on the personal recommendation of a senior clinician who has expressed strong support for the technique, without undertaking further independent verification or formal approval processes. Option C. Initiate a formal validation study for the assay, seek ethical approval for its use in a pilot program, and consult with relevant professional bodies and institutional governance committees regarding its potential integration into routine practice, adhering to established NHS guidelines for new technology adoption. Option D. Rely on the anecdotal evidence and enthusiasm from the research group that developed the assay, and proceed with its widespread adoption in the department based on their assurances of its efficacy. Correct answer is C. Initiate a formal validation study for the assay, seek ethical approval for its use in a pilot program, and consult with relevant professional bodies and institutional governance committees regarding its potential integration into routine practice, adhering to established NHS guidelines for new technology adoption. Explanation. Scenario analysis. This scenario presents a common challenge in pathology where a novel diagnostic technique, while promising, lacks established validation and regulatory approval within the UK healthcare system, specifically concerning its use in NHS diagnostic pathways. The professional challenge lies in balancing the potential benefits of innovation with the paramount responsibility to patient safety, diagnostic accuracy, and adherence to established clinical governance frameworks. Pathologists must navigate the ethical imperative to offer the best possible care against the risks associated with unproven methods, which could lead to misdiagnosis, inappropriate treatment, and erosion of patient trust. The requirement for robust evidence, peer review, and regulatory oversight is central to maintaining the integrity of pathology services. Correct approach analysis. The correct approach, which involves seeking formal validation, obtaining ethical approval, and adhering to established guidelines for introducing new diagnostic tests within the UK National Health Service, NHS, represents best professional practice. This aligns directly with the principles of good clinical practice and the regulatory framework governing healthcare in the UK. The Royal College of Pathologists, FRCPath, strongly advocates for evidence-based practice and the rigorous evaluation of new technologies before widespread adoption. This approach ensures that any new diagnostic method has undergone scrutiny for accuracy, reliability, and clinical utility, thereby safeguarding patient welfare and maintaining diagnostic standards. It also respects the established pathways for technology appraisal and implementation within the NHS, ensuring that resources are used effectively and ethically. Incorrect approaches analysis. Introducing the novel technique without prior validation or regulatory approval constitutes a significant ethical and regulatory failure. It bypasses essential quality assurance mechanisms designed to protect patients from potentially inaccurate or misleading results. This approach violates the principle of beneficence by exposing patients to unknown risks and the principle of non-maleficence by potentially causing harm through misdiagnosis. It also undermines professional accountability and the established governance structures within the NHS. Adopting the technique based solely on anecdotal evidence or the enthusiasm of a research group, without independent verification or peer review, is professionally unsound. This approach prioritizes enthusiasm over evidence, which is contrary to the scientific ethos of pathology and the FRCPath's commitment to evidence-based medicine. It risks introducing unreliability into diagnostic pathways and could lead to inappropriate clinical decisions, impacting patient outcomes and potentially leading to litigation. Relying on the opinion of a single senior clinician, even if experienced, without broader consensus or formal validation, is insufficient. While clinical opinion is valuable, it cannot substitute for the systematic evaluation required for diagnostic test implementation. This approach fails to acknowledge the collective responsibility for patient safety and the need for robust, reproducible evidence that can be applied across a wider patient population. It represents a failure to adhere to established protocols for the introduction of new diagnostic modalities. Professional reasoning. When faced with a novel diagnostic technique, a pathologist's decision-making process should be guided by a commitment to patient safety, diagnostic accuracy, and adherence to professional standards and regulatory requirements. This involves a systematic evaluation of the evidence supporting the technique, considering its potential benefits and risks. The pathologist should consult relevant professional bodies, such as the FRCPath, and follow established guidelines for the introduction of new technologies within their institution and the wider healthcare system. This includes seeking validation studies, obtaining ethical approval where necessary, and ensuring that the technique aligns with current clinical guidelines and best practices. A collaborative approach, involving multidisciplinary teams and seeking peer review, is crucial for informed decision-making. Question 12. The performance metrics show a sustained increase in the false negative rate for cervical cytology screening over the past quarter. What is the most appropriate initial step to address this trend? Option A. Immediately implement a mandatory retraining program for all cytotechnologists and pathologists involved in cervical cytology reporting, regardless of individual performance data. Option B. Initiate a comprehensive review of the entire cytopathology workflow, from specimen accessioning to final report generation, to identify potential systemic issues, followed by targeted staff training and competency reassessment based on findings. Option C. Document the increase in the false negative rate as a statistical anomaly and continue routine quality control measures without further investigation, assuming it will self-correct. Option D. Conduct individual performance reviews for all staff members involved in cervical cytology, focusing on identifying and addressing any perceived individual performance deficiencies. The correct answer is B. Initiate a comprehensive review of the entire cytopathology workflow, from specimen accessioning to final report generation, to identify potential systemic issues, followed by targeted staff training and competency reassessment based on findings. Explanation. Scenario analysis. This scenario presents a common challenge in cytopathology laboratories, identifying and addressing suboptimal performance in a specific area of quality assurance. The professional challenge lies in interpreting performance metrics accurately, distinguishing between systemic issues and individual variations, and implementing an effective, evidence-based corrective action plan that upholds patient safety and regulatory compliance without undue punitive measures. The requirement to adhere strictly to FRCPath guidelines means that any proposed solution must align with the established standards for quality management in UK pathology services. Correct approach analysis. The correct approach focuses on a systematic, multifaceted investigation and intervention strategy. This aligns with the principles of continuous quality improvement mandated by regulatory bodies and professional colleges. By initiating a review of the entire specimen handling and reporting pathway, from initial accessioning to final sign-out, the aim is to identify the root cause of the increased false negative rate. This includes evaluating pre-analytical factors, e.g., sample adequacy fixation, analytical factors, e.g., staining, slide preparation, microscope calibration, and post-analytical factors, e.g., reporting accuracy, communication. Implementing targeted training and competency assessment for staff involved in the affected stages directly addresses potential skill gaps or procedural deviations. Furthermore, establishing a clear action plan with defined timelines and reevaluation metrics ensures accountability and demonstrates a commitment to sustained improvement. This approach is ethically sound as it prioritizes patient safety by proactively addressing potential diagnostic errors and is compliant with FRCPath expectations for robust quality management systems. Incorrect approaches analysis. Focusing solely on individual performance without a broader systemic review is a significant regulatory and ethical failure. It risks misdiagnosing the problem, potentially leading to unfair disciplinary action against staff members, while the underlying systemic issues remain unaddressed. This violates the principle of a fair and just culture, which is integral to effective quality management in healthcare. Such an approach fails to meet the FRCPath requirement for a comprehensive quality assurance program that investigates all potential sources of error. Implementing immediate, broad disciplinary measures without a thorough investigation is also a failure. It bypasses the due process required for performance management and can create a climate of fear, discouraging open reporting of errors or concerns. This is contrary to best practice in quality improvement and ethical employment standards. It also fails to identify the actual cause of the increased false negative rate, thus not resolving the core issue and potentially leading to continued patient risk. Ignoring the performance metrics and attributing the increase to random variation is a dereliction of professional duty and a direct contravention of quality assurance principles. Regulatory bodies, including those underpinning FRCPath standards, expect laboratories to actively monitor performance and investigate deviations. Failure to do so constitutes a breach of professional responsibility and exposes patients to potential harm. This approach demonstrates a lack of commitment to patient safety and regulatory compliance. Professional reasoning. Professionals facing such a situation should adopt a structured problem-solving approach. First, acknowledge the data and its potential implications for patient care. Second, initiate a comprehensive, unbiased investigation to identify the root cause, considering all aspects of the diagnostic process. Third, engage relevant stakeholders, including laboratory staff, in the investigation and solution development. Fourth, implement evidence-based interventions, prioritizing those that address the identified root cause. Fifth, establish clear metrics for monitoring the effectiveness of interventions and commit to ongoing review and adaptation. This systematic process ensures that decisions are data-driven, ethically sound, and aligned with professional and regulatory expectations for delivering high-quality patient care. Question 13. Market research demonstrates that a significant proportion of trainees struggle with the nuanced differentiation between reactive epithelial changes and early-stage adenocarcinoma in biopsy specimens of the gastrointestinal tract. A 65-year-old male presents with vague abdominal discomfort. An endoscopic biopsy of the gastric mucosa reveals a focus of glandular proliferation with some nuclear crowding and mild nuclear enlargement. There is no overt cellular pleomorphism or significant mitotic activity. The surrounding lamina propria shows a mild inflammatory infiltrate. Which of the following approaches represents the most appropriate diagnostic strategy in this scenario? Adhering to the principles of accurate histopathological diagnosis expected for the FRCPath. Option A. Focus solely on the mild inflammatory infiltrate, attributing all epithelial changes to reactive processes secondary to inflammation. Option B. Request immunohistochemical stains for mismatch repair proteins, MLH1, MSH2, MSH6, PMS2, and Chi-67 to further assess the proliferative activity and potential for underlying genetic instability. Option C. Immediately classify the lesion as a low-grade adenocarcinoma based on the nuclear crowding and enlargement, recommending further investigation for metastatic disease. Option D. Conclude that the changes are benign reactive atypia due to the absence of overt malignant features and report accordingly. The correct answer is D. Conclude that the changes are benign reactive atypia due to the absence of overt malignant features and report accordingly. Explanation. This scenario presents a common challenge in histopathology, distinguishing between reactive or inflammatory changes and true neoplastic proliferation, particularly when subtle morphological features are present. The professional challenge lies in the potential for misdiagnosis, which can have significant implications for patient management, including unnecessary invasive procedures or delayed treatment for malignancy. The pathologist must exercise meticulous attention to detail, integrate clinical information, and apply established diagnostic criteria to arrive at the most accurate conclusion. The correct approach involves a comprehensive evaluation of all available data. This includes a thorough review of the H&E stain slides, considering architectural patterns, cellular morphology, nuclear atypia, pleomorphism, mitotic activity, and the surrounding stromal reaction. Crucially, it necessitates correlating these findings with the provided clinical history, imaging, and any relevant ancillary investigations such as immunohistochemistry or molecular studies. Adherence to established diagnostic criteria, as outlined by authoritative bodies and consensus guidelines relevant to the FRCPath examination, ensures objectivity and reproducibility. This systematic approach minimizes subjective interpretation and aligns with the professional duty of care to provide accurate and timely diagnoses, thereby upholding patient safety and trust in the diagnostic process. An incorrect approach would be to solely rely on a single morphological feature without considering the broader context. For instance, identifying a few atypical cells without assessing their distribution, the overall cellularity, or the presence of a cohesive proliferation would be insufficient. This overlooks the possibility of reactive atypia, which can mimic malignancy. Another incorrect approach would be to disregard the clinical information. A lesion that appears borderline on morphology might be interpreted differently if the patient has a known history of malignancy or specific risk factors. Failing to utilize or request appropriate ancillary studies when morphological features are equivocal would also be a significant professional failing, as these tools are designed to clarify diagnostic uncertainties and are integral to modern histopathological practice. Such omissions can lead to misclassification, impacting treatment decisions, and potentially violating the principles of good medical practice and the standards expected by the FRCPath. The professional decision-making process for similar situations should involve a structured approach. 1. Thorough review of all available slides and clinical information. 2. Systematic assessment of morphological features against established diagnostic criteria. 3. Consideration of differential diagnoses, including both neoplastic and non-neoplastic possibilities. 4. Identification of any diagnostic uncertainties and the need for ancillary investigations, e.g., immunohistochemistry, molecular testing. 5. Consultation with senior colleagues or subspecialists if diagnostic confidence is low. 6. Clear and concise reporting of findings, including any limitations or recommendations for further management. Question 14. Consider a scenario where a junior registrar in histopathology, while examining a biopsy specimen, identifies a subtle cellular morphology that is not typical of the expected benign condition, but also does not immediately fit a clear malignant diagnosis. The registrar is under pressure to clear their workload for the day. What is the most appropriate course of action? Option A. Report the finding as a minor deviation from the expected benign diagnosis, assuming it is within normal variation, and proceed to the next case. Option B. Attribute the unusual morphology to a known processing artifact without further investigation, as artifacts are common in biopsies. Option C. Document the unusual morphology and immediately consult with a senior pathologist or specialist in the relevant subdiscipline for their opinion and guidance on further steps. Option D. Omit mentioning the unusual morphology in the report to avoid causing unnecessary concern to the referring clinician and patient, given the ambiguity. The correct answer is A. Report the finding as a minor deviation from the expected benign diagnosis, assuming it is within normal variation, and proceed to the next case. Explanation. Scenario analysis. This scenario presents a common yet challenging situation in pathology where a junior registrar encounters an unexpected and potentially significant finding that deviates from the expected diagnosis. The professional challenge lies in balancing the need for timely reporting with the imperative of diagnostic accuracy and patient safety. The registrar must exercise sound clinical judgment, consult appropriately, and ensure that the final report reflects the most accurate interpretation of the findings, adhering to established diagnostic criteria and best practices. The pressure to complete workload can sometimes conflict with the meticulousness required for complex cases. Correct approach analysis. The correct approach involves the registrar meticulously reviewing the case, consulting with a senior colleague or specialist in the relevant subdiscipline, and potentially requesting additional ancillary tests or a second opinion if necessary. This aligns with the fundamental principles of good medical practice and the ethical obligations of a pathologist. Specifically, it upholds the duty of care to the patient by ensuring diagnostic accuracy. From a regulatory perspective, it adheres to the standards expected by the Royal College of Pathologists, FRCPath, for training and practice, which emphasize supervision, consultation, and continuous professional development. The FRCPath curriculum and assessment framework implicitly require trainees to demonstrate the ability to manage complex cases and seek appropriate guidance, ensuring that patient care is not compromised by inexperience or uncertainty. This approach prioritizes patient well-being and diagnostic integrity over speed. Incorrect approaches analysis. Reporting the finding as a minor anomaly without further investigation or consultation represents a significant failure in professional responsibility and adherence to regulatory expectations. This approach risks misdiagnosis, leading to inappropriate patient management and potentially serious harm. It violates the ethical principle of non-maleficence and the duty to provide competent care. From a regulatory standpoint, it demonstrates a lack of diligence and a failure to follow established diagnostic pathways, which could be considered a breach of professional standards expected by the FRCPath. Attributing the finding to a known artifact without confirming its nature or exploring alternative explanations is also professionally unacceptable. Artifacts can mimic genuine pathological changes, and a failure to differentiate can lead to overlooking critical diagnoses. This approach shows a lack of critical appraisal and a premature conclusion, potentially compromising patient care and failing to meet the rigorous diagnostic standards of the FRCPath. Ignoring the finding altogether due to time constraints is the most egregious failure. This directly contravenes the pathologist's duty of care and the fundamental principles of diagnostic pathology. It is a clear breach of ethical and professional conduct and would be viewed extremely seriously by the FRCPath, potentially leading to disciplinary action. It demonstrates a disregard for patient safety and the integrity of the diagnostic process. Professional reasoning. Professionals in this situation should adopt a systematic approach. Firstly, acknowledge the unexpected finding and its potential significance. Secondly, consult relevant diagnostic guidelines and literature. Thirdly, seek immediate advice from a senior colleague or supervisor, presenting the case clearly with all available data. Fourthly, be prepared to undertake further investigations as advised. This iterative process of review, consultation, and investigation ensures that all findings are thoroughly evaluated, leading to the most accurate and clinically relevant report, thereby upholding the highest standards of patient care and professional integrity as mandated by the FRCPath. Question 15. The investigation demonstrates significant cellular atypia on histological examination of a biopsy, alongside elevated serum markers indicative of organ dysfunction and a history of recent trauma. Option A. Focus solely on the histological findings, as they provide the most definitive evidence of cellular changes. Option B. Immediately classify the case as a forensic pathology matter due to the presence of trauma. Option C. Integrate findings from anatomical pathology, clinical pathology, and forensic pathology to formulate a comprehensive diagnostic assessment and management plan. Option D. Prioritize the serum marker results, as they reflect the patient's current physiological state. The correct answer is C. Integrate findings from anatomical pathology, clinical pathology, and forensic pathology to formulate a comprehensive diagnostic assessment and management plan. Explanation: scenario analysis. This scenario presents a professional challenge due to the potential for misinterpretation of findings across different pathology disciplines. A pathologist must integrate information from anatomical pathology, tissue morphology, with clinical pathology, laboratory test results, and potentially forensic pathology, if the context suggests external factors or legal implications. The challenge lies in synthesizing these diverse data points into a coherent diagnostic and prognostic picture, ensuring that each discipline's contribution is accurately understood and applied without overstepping boundaries or making assumptions outside their expertise. The need for clear communication and collaboration between specialists is paramount. Correct approach analysis. The correct approach involves a comprehensive review of all available data, recognizing the distinct but interconnected roles of anatomical, clinical, and forensic pathology. Anatomical pathology provides the direct examination of tissue, identifying cellular abnormalities and structural changes. Clinical pathology offers insights into physiological processes and biochemical markers. Forensic pathology, when applicable, adds a layer of investigation into cause of death or injury, often involving external factors. Best professional practice dictates that the pathologist integrates these findings, seeking expert consultation where necessary, to arrive at the most accurate diagnosis and management plan. This aligns with the FRCPath's emphasis on evidence-based practice and multidisciplinary collaboration, ensuring patient safety and optimal outcomes. Regulatory frameworks for pathology practice in the UK, governed by bodies like the Royal College of Pathologists and GMC, mandate accurate diagnosis, clear reporting, and appropriate communication, all of which are facilitated by this integrated approach. Incorrect approaches analysis. One incorrect approach would be to solely rely on the anatomical pathology findings without considering the clinical pathology data. This fails to acknowledge the dynamic nature of disease and the crucial role of laboratory investigations in assessing organ function, disease activity, and response to treatment. Ethically and regulatorily, this represents a failure to provide a complete diagnostic picture, potentially leading to misdiagnosis or inappropriate management, violating the GMC's guidance on good medical practice. Another incorrect approach would be to focus exclusively on the clinical pathology results and disregard the anatomical findings. This overlooks the definitive diagnostic power of tissue examination, which is often the gold standard for identifying specific diseases like cancer or inflammatory conditions. Such an approach would be a significant deviation from established pathology practice and would contravene the FRCPath standards for diagnostic accuracy. A third incorrect approach would be to prematurely apply forensic pathology principles without sufficient evidence or context. While forensic pathology is a distinct specialty, its application should be guided by specific circumstances, e.g., unexplained death, suspected foul play. Introducing forensic considerations without a clear indication could lead to unnecessary investigations, distress for the patient or their family, and a misdirection of resources, failing to adhere to the principles of proportionality and evidence-based practice. Professional reasoning. Professionals should adopt a systematic approach. First, thoroughly review and understand the findings from each relevant pathology discipline. Second, identify any discrepancies or areas requiring further clarification. Third, consult with colleagues in other specialties if the case spans multiple disciplines or if there is uncertainty. Fourth, synthesize all information to formulate a comprehensive diagnosis and recommend appropriate further steps, always prioritizing patient well-being and adhering to professional and regulatory standards. Question 16. Upon reviewing histological sections of a breast biopsy, a pathologist observes a proliferation of atypical ductal epithelial cells with some nuclear pleomorphism and occasional mitotic figures. The surrounding stroma shows mild desmoplasia. The clinical history suggests a palpable lump. Which of the following diagnostic approaches best aligns with the established diagnostic criteria for common breast diseases within the UK regulatory framework for pathology practice? Option A. A diagnosis solely based on the clinical suspicion of malignancy, irrespective of the detailed histological findings. Option B. A diagnosis based primarily on the presence of atypical cells and desmoplasia, assuming malignancy without further detailed morphological evaluation. Option C. A comprehensive assessment of nuclear features, architectural patterns, mitotic activity, and stromal response, comparing these findings against established diagnostic criteria for ductal carcinoma in situ and invasive ductal carcinoma. Option D, deferring the diagnosis to a senior pathologist without an initial thorough review of the morphological features and comparison with diagnostic criteria. The correct answer is C, a comprehensive assessment of nuclear features, architectural patterns, mitotic activity, and stromal response, comparing these findings against established diagnostic criteria for ductal carcinoma in situ and invasive ductal carcinoma. Explanation: scenario analysis. This scenario presents a common challenge in diagnostic pathology, differentiating between benign and malignant conditions based on histological features, particularly when dealing with subtle or overlapping morphologies. The professional challenge lies in the significant implications of misdiagnosis, which can lead to inappropriate patient management, including unnecessary invasive procedures or delayed treatment for potentially life-threatening diseases. Pathologists must exercise meticulous attention to detail, integrate clinical information, and adhere to established diagnostic criteria to ensure accuracy and patient safety. The FRCPath examination specifically assesses this ability to apply diagnostic criteria rigorously within the UK regulatory framework for pathology practice. Correct approach analysis. The correct approach involves a systematic evaluation of key morphological features that are internationally recognized and codified within diagnostic guidelines, such as those published by the World Health Organization, WHO, Classification of Tumor Series, which are standard references in UK pathology. This approach prioritizes objective assessment of cellular atypia, architectural disorganization, mitotic activity, and evidence of invasion or metastases. Adherence to these established criteria ensures consistency, reproducibility, and alignment with best practices in diagnostic pathology, as expected by the FRCPath and regulated by bodies like the Royal College of Pathologists. This method directly addresses the diagnostic challenge by relying on evidence-based benchmarks. Incorrect approaches analysis. One incorrect approach relies solely on a single prominent feature without considering the full spectrum of diagnostic criteria. This is professionally unacceptable as it oversimplifies complex diagnoses and can lead to misclassification. For example, focusing only on mitotic count without assessing nuclear pleomorphism or architectural changes can result in false positives or negatives. This violates the principle of comprehensive assessment mandated by good clinical practice and the standards expected by the FRCPath. Another incorrect approach is to base the diagnosis primarily on the perceived clinical impression without sufficient histological correlation. While clinical context is crucial, the definitive diagnosis in histopathology rests on microscopic examination. Over-reliance on clinical suspicion can lead to confirmation bias and a failure to identify subtle but critical histological findings. This deviates from the pathologist's primary responsibility to provide an objective, evidence-based diagnosis from the specimen, as stipulated by professional guidelines. A further incorrect approach involves deferring the diagnosis to a more senior colleague without undertaking a thorough initial assessment. While consultation is a valuable part of professional development and complex case management, it should follow a diligent personal review of the case. Unwarranted deferral without initial critical evaluation can indicate a lack of confidence in applying diagnostic criteria or an abdication of responsibility, which is contrary to the professional standards expected of a fellow of the Royal College of Pathologists. Professional reasoning. Professionals should approach diagnostic challenges by first meticulously reviewing all available histological slides, paying close attention to cellular morphology, nuclear features, cytoplasmic characteristics, and tissue architecture. This should be followed by a thorough integration of the provided clinical history and relevant ancillary investigations. Comparison with established diagnostic criteria, such as those found in authoritative textbooks and WHO classifications, is essential. When uncertainty persists, consultation with colleagues or referral to specialist centers should be considered, but only after a comprehensive personal assessment has been performed. This systematic, evidence-based approach ensures diagnostic accuracy, patient safety, and adherence to professional and regulatory standards. Question 17. The audit findings indicate a persistent discrepancy in the classification of a complex hematological case, with the junior pathologist initially categorizing it based on morphological features alone, while a senior colleague suggested a different classification based on a combination of morphology and limited immunophenotyping. The laboratory director needs to ensure the most accurate and current diagnostic approach is applied. Which of the following represents the most appropriate process optimization for resolving this classification discrepancy? Option A. Develop a new internal classification system for this specific case to avoid future similar discrepancies. Option B. Adopt the classification suggested by the senior colleague, assuming their experience supersedes the need for further investigation. Option C. Reevaluate the case using the latest edition of the World Health Organization, WHO, classification of tumors of hematopoietic and lymphoid tissues, integrating all available diagnostic data including morphology, immunophenotyping, cytogenetics, and molecular studies where indicated to arrive at a definitive classification. Option D. Classify the case based on the initial morphological assessment, as this is the foundational diagnostic tool in hematopathology. Correct answer is C. Reevaluate the case using the latest edition of the World Health Organization, WHO, classification of tumors of hematopoietic and lymphoid tissues, integrating all available diagnostic data including morphology, immunophenotyping, cytogenetics, and molecular studies where indicated to arrive at a definitive classification. Explanation. Scenario analysis. This scenario presents a common challenge in pathology practice where discrepancies in diagnostic classification can arise due to evolving understanding of disease entities, variations in diagnostic criteria, or differing interpretations of morphological and molecular features. The professional challenge lies in ensuring diagnostic accuracy and consistency, which directly impacts patient management, treatment decision, and prognostic assessment. Adherence to established classification systems is paramount for clear communication within the multidisciplinary team and for accurate epidemiological reporting. Correct approach analysis. The correct approach involves a thorough review of the case, considering all available diagnostic information, and applying the most current and widely accepted classification system for hematological disorders. In the context of FRCPath, this means referencing the World Health Organization, WHO, classification of tumors of hematopoietic and lymphoid tissues. The system provides standardized criteria for diagnosing and categorizing anemias, leukemias, and lymphomas, ensuring consistency and comparability of diagnoses across different laboratories and clinicians. Adhering to the WHO classification is a cornerstone of good laboratory practice and aligns with the professional responsibility to provide accurate and up-to-date diagnostic services, as expected of a fellow of the Royal College of Pathologists. Incorrect approach is analysis, an approach that relies solely on older classification systems, such as the FAB, French-American-British, classification for leukemias, would be professionally unacceptable. This failure represents a lack of engagement with current scientific advancements and diagnostic standards, potentially leading to misclassification and inappropriate patient management. It also demonstrates a disregard for the established professional expectation to practice at the forefront of the discipline. Another incorrect approach would be to prioritize a single diagnostic modality, e.g., morphology alone, over a comprehensive assessment that includes immunophenotyping, cytogenetics, and molecular studies, especially when these are indicated by the initial findings and are crucial for definitive classification under current WHO guidelines. This selective application of diagnostic tools can lead to incomplete or inaccurate diagnoses, failing to meet the expected standard of care, and potentially violating ethical obligations to the patient. Finally, an approach that involves creating a novel or idiosyncratic classification system for the case, without robust scientific justification or peer review, would be professionally unsound. This undermines the principle of standardized diagnostic nomenclature, hindering effective communication and potentially leading to confusion and errors in patient care. It also deviates from the established regulatory and professional expectation of adhering to internationally recognized diagnostic frameworks. Professional reasoning. Professionals faced with diagnostic discrepancies should adopt a systematic and evidence-based approach. This involves 1. Acknowledging the discrepancy. 2. Gathering all relevant clinical and laboratory data. 3. Consulting current authoritative classification systems, e.g., Who, 4. Seeking expert opinion if necessary, and 5. Documenting the diagnostic process and rationale clearly. This methodical approach ensures diagnostic accuracy, upholds professional standards, and prioritizes patient well-being. Question 18. Examination of the data shows a neonate presenting with lethargy, poor feeding, and a characteristic odor. Biochemical investigations reveal elevated serum ammonia, hypoglycemia, and evidence of ketonuria. Considering the potential disruption of key metabolic pathways, which of the following diagnostic strategies best reflects an integrated approach to identifying the underlying cause? Option A. Prioritize investigations targeting urea cycle defects, given the elevated ammonia, and consider further testing for inborn errors of amino acid metabolism if initial results are inconclusive. Option B. Initiate a broad panel of genetic tests for all known metabolic disorders without initial biochemical correlation. Option C. Recommend immediate liver transplantation without further diagnostic workup, assuming a severe metabolic insult. Option D. Focus solely on ruling out sepsis as the cause of the neonate symptoms, as this is a common presentation in newborns. The correct answer is A. Prioritize investigations targeting urea cycle defects, given the elevated ammonia, and consider further testing for inborn errors of amino acid metabolism if initial results are inconclusive. Explanation. Scenario analysis. This scenario presents a common challenge in clinical pathology, interpreting complex biochemical data in the context of a patient's presentation and determining the most appropriate diagnostic and management pathway. The challenge lies in integrating knowledge of metabolic pathways with clinical signs and symptoms, while adhering to the rigorous standards of practice expected of a fellow of the Royal College of Pathologists. The need for accurate diagnosis and timely intervention, guided by evidence-based practice and ethical considerations, is paramount. Misinterpretation can lead to delayed or incorrect treatment, impacting patient outcomes. Correct approach analysis. The correct approach involves a systematic evaluation of the presented biochemical abnormalities in relation to known metabolic pathways and their clinical manifestations. This requires a deep understanding of how disruptions in specific pathways, such as amino acid metabolism or carbohydrate metabolism, lead to characteristic biochemical profiles and symptoms. The chosen approach should prioritize the identification of the most likely underlying metabolic disorder based on the constellation of findings, leading to targeted investigations and appropriate patient management. This aligns with the FRCPath's commitment to evidence-based medicine and the highest standards of diagnostic accuracy. Ethical considerations mandate that the pathologist's interpretation directly contributes to the patient's well-being and facilitates effective clinical decision-making. Incorrect approaches analysis, focusing solely on a single, isolated biochemical abnormality without considering the broader metabolic context or clinical presentation, is a significant failure. This approach risks overlooking the interconnectedness of metabolic pathways and may lead to a misdiagnosis or an incomplete understanding of the patient's condition. It fails to demonstrate the comprehensive analytical skills expected of a FRCPath. Interpreting the biochemical data without reference to established metabolic pathway knowledge or clinical guidelines represents a departure from best professional practice. This approach is not evidence-based and could result in arbitrary or inaccurate conclusions, potentially harming the patient. It demonstrates a lack of critical appraisal and adherence to professional standards. Recommending a broad, nonspecific panel of further investigations without a clear diagnostic hypothesis derived from the initial data is inefficient and potentially wasteful of resources. While comprehensive testing can be valuable, it should be guided by a reasoned differential diagnosis informed by the initial findings and knowledge of metabolic pathways. This approach lacks the focused, analytical rigor expected. Professional reasoning. Professionals should approach such scenarios by first reviewing the patient's clinical information and the provided biochemical data. They should then systematically consider how the observed abnormalities relate to known metabolic pathways, formulating a differential diagnosis. This involves recalling or referencing established knowledge of metabolic disorders and their biochemical signatures. The next step is to identify the most probable diagnosis based on the totality of the evidence. Finally, the pathologist should recommend targeted investigations that will confirm or refute the leading hypotheses, thereby guiding effective patient management. This process emphasizes critical thinking, evidence-based practice, and a patient-centered approach. Question 19. Performance analysis shows a consistent trend of some junior pathologists in your department providing less detailed tumor grading and staging information in their reports for common malignancies, often relying on the referring clinician to request further clarification or to infer details from the overall diagnostic impression. This practice has led to occasional delays in MDT discussions and suboptimal treatment planning. As a senior pathologist responsible for training and quality assurance, what is the most appropriate course of action to address this issue? Option A. Advise junior pathologists to verbally communicate any perceived ambiguities or missing information directly to the referring clinician after they have completed their initial report, encouraging them to use their clinical judgment to decide when such communication is necessary. Option B. Update the departmental reporting template to include a mandatory section for clinical correlation requested, which junior pathologists can tick if they believe further clinical information is needed to complete the grading or staging, thereby shifting the onus to the clinician. Option C. Implement mandatory, structured training sessions for junior pathologists focusing on the specific requirements of tumor grading and staging for common malignancies, emphasizing the importance of comprehensive reporting and the potential consequences of incomplete information, and establish a robust peer review system for all grading and staging reports before final sign-out. Option D. Encourage junior pathologists to adopt a more concise reporting style, focusing only on the definitive diagnosis, and to defer detailed grading and staging to specialist oncologists who are better equipped to interpret these findings in the context of treatment. The correct answer is C. Implement mandatory, structured training sessions for junior pathologists focusing on the specific requirements of tumor grading and staging for common malignancies, emphasizing the importance of comprehensive reporting and the potential consequences of incomplete information, and establish a robust peer review system for all grading and staging reports before final sign-out. Explanation. This scenario presents a professional challenge rooted in the ethical imperative to provide accurate and timely diagnostic information to guide patient management, while simultaneously navigating the complexities of interdisciplinary communication and potential resource limitations. The pathologist's role in tumor grading and staging is critical, directly influencing treatment decisions, prognosis, and patient counseling. Misinterpretation or delayed reporting can have profound consequences for patient care. The correct approach prioritizes clear, accurate, and comprehensive reporting of tumor grade and stage, adhering strictly to established diagnostic criteria and reporting guidelines relevant to the FRCPath examination's jurisdiction, UK. This involves meticulous examination of histological features, application of validated grading systems, e.g., Nottingham grading for breast cancer, Gleason scoring for prostate cancer, and accurate staging based on pathological findings, all documented in a clear and unambiguous report. This aligns with the professional duty of care, the principles of good medical practice, and the regulatory expectations for specialist pathologists in the UK, ensuring that the multidisciplinary team, MDT, has the necessary information for optimal patient management. An incorrect approach would involve making assumptions about the clinical context or the referring clinician's expectations without direct verification, potentially leading to an incomplete or misleading report. For instance, omitting specific grading details or staging components due to perceived time constraints or a belief that the clinician will infer them would be a significant ethical and regulatory failure. This demonstrates a lack of diligence and a disregard for the structured reporting requirements that underpin patient safety and effective healthcare delivery within the UK system. Another incorrect approach would be to provide a preliminary or provisional grade/stage without clearly indicating its tentative nature, which could lead to premature treatment decisions based on potentially inaccurate information. This violates the principle of providing definitive diagnostic information and could result in patient harm. Furthermore, failing to communicate significant findings or uncertainties promptly to the clinical team, especially when they impact immediate management, constitutes a breach of professional responsibility and can disrupt the MDT process, a cornerstone of cancer care in the UK. The professional decision-making process in such situations should involve a systematic approach. First, Thoroughly review all available histological material and relevant clinical information. Second, apply the appropriate, validated grading and staging systems meticulously. Third, ensure the report is clear, concise, and comprehensive, adhering to any institutional or national reporting standards. Fourth, if there are any ambiguities, uncertainties, or critical findings that require immediate discussion, proactively communicate these with the referring clinician or the MDT. Finally, maintain a commitment to continuous professional development to stay abreast of evolving diagnostic criteria and reporting guidelines. Question 20. Quality control measures reveal that a fine needle aspiration (FNA) sample submitted for cytological examination is significantly hypocellular, with very few diagnostic cells present, making a definitive diagnosis impossible. The referring clinician has not been informed of this preliminary assessment of inadequacy. What is the most appropriate immediate course of action for the reporting pathologist? Option A. Immediately contact the referring clinician to discuss the sample inadequacy and recommend a repeat fine needle aspiration. Option B. Attempt to reprocess the existing sample using enhanced staining techniques to improve cell visualization before reporting. Option C. Interpret the sample as best as possible, noting the limited cellularity, and issue a report without further consultation. Option D. Proceed with reporting the sample as limited diagnostic material and highlight any minimal findings without explicitly recommending a repeat FNA. The correct answer is A. Immediately contact the referring clinician to discuss the sample inadequacy and recommend a repeat fine needle aspiration. Explanation. Scenario analysis. This scenario presents a professional challenge where a discrepancy in cytological sample adequacy for a fine needle aspiration (FNA) is identified during quality control. The challenge lies in balancing the need for timely patient care and diagnostic accuracy with the principles of good laboratory practice and patient safety. The pathologist must decide on the most appropriate course of action without compromising the integrity of the diagnostic process or patient outcomes, adhering strictly to the principles of the Royal College of Pathologists, FRCPath, guidelines for cytology. Correct approach analysis. The correct approach involves immediate communication with the referring clinician to discuss the inadequacy of the sample and the necessity for a repeat FNA. This aligns with FRCPath guidelines on specimen adequacy and the ethical obligation to provide accurate diagnoses. Prompt communication ensures that the patient's diagnostic pathway is not unduly delayed and that the clinician can make informed decisions regarding further management. This proactive approach upholds the principles of patient-centered care and professional responsibility, ensuring that diagnostic services are delivered to the highest standard. Incorrect approach is analysis. Failing to communicate the inadequacy and proceeding with interpretation would be a significant regulatory and ethical failure. This breaches the principle of providing an accurate and reliable diagnosis, potentially leading to misdiagnosis or delayed diagnosis, which can have serious consequences for patient management. It also contravenes the implicit understanding that a reported cytological sample meets minimum adequacy criteria. Reporting the sample as limited or suspicious without explicitly stating the inadequacy and recommending a repeat FNA is also professionally unacceptable. It acknowledges some findings. It fails to clearly communicate the diagnostic limitations imposed by the poor sample quality. This can mislead the clinician into believing a definitive diagnosis has been made, or that the findings are more significant than the sample quality allows for confident interpretation, thereby failing to meet the standard of clear and unambiguous reporting expected by the FRCPath. Deciding to reprocess the existing sample without consulting the referring clinician or a senior colleague is also problematic. While some reprocessing techniques might exist, their efficacy for improving adequacy in all cases is not guaranteed, and it bypasses the established communication channels for specimen issues. This approach risks expending laboratory resources on a potentially unresolvable issue and delays the definitive action of obtaining a new, adequate sample, potentially impacting patient care timelines. Professional reasoning. Professionals should employ a systematic decision-making framework when encountering specimen quality issues. This involves 1. Identifying the quality issue, e.g., sample inadequacy. 2. Consulting relevant internal protocols and external guidelines, e.g., FRCPath cytology guidelines. 3. Assessing the impact of the quality issue on diagnostic reliability. 4. Communicating the issue clearly and promptly to the referring clinician, outlining the implications and recommending the most appropriate next steps. 5. Documenting all communications and decisions. This framework ensures a patient-focused, ethically sound, and professionally responsible approach to diagnostic challenges.